Welcome back, everyone. Today, the Texas Attorney General announced he secured a first-of-its-kind settlement over transgender care for children. Ken Paxton says this requires Texas Children's Hospital to pay $10 million and open a detransition clinic. Let's get some more information about this now with Colleen DeGuzman with the Texas Tribune. Colleen, thanks for joining us. Welcome back to our show.
Thank you for having me.
Let's talk first about what the terms of this settlement are specifically and how unusual this really is.
So right now we know very little about the settlement. Both the Attorney General and Texas Children's have not released a copy of the settlement to us yet. We also don't know what the names of the 5 physicians who were terminated as part of this settlement. From what we do know, it's a pretty unusual settlement for many reasons. I mean, I haven't heard of a settlement including the creation of a clinic, especially a detransitioning clinic that's set to be the nation's first. We still have many questions on what a detransition clinic is and what it would look like and what kind of services it would offer. Whether it would emphasize mental health resources, that's a big concern for a lot of the advocates that I spoke to today. But in a statement, Texas Children said it was, quote, a difficult decision to settle with Ken Paxton this way.
I want to circle back to the clinic in just a moment and what the Attorney General is saying about this. What ultimately led to this settlement getting reached? Was it some sort of investigation or a lawsuit facing that hospital?
So it was an investigation, and this all began in 2023 when the Attorney General launched an investigation into the Texas Children's Hospital for providing transition-related care to minors. At the time, it was the second investigation he had launched related to gender transitioning. And so because it was just an investigation, there was no lawsuit. We have not heard of any lawsuits yet. Paxton had also investigated Dell Children's Hospital in Austin for providing gender transitioning care. And in 2023, the Texas legislature at the time had passed a bill barring minors from receiving such medical care, including puberty blockers, hormone therapy, and other related surgeries. But it's really important to note that these kinds of surgeries are extremely rare, especially for minors.
Yeah, and that's a great point to make and some context to add to this. We mentioned, of course, a few moments ago, the hospital will have to open this first ever detransition clinic. What the Attorney General is saying, this is the first of its kind across the entire country. What did he say that would mean exactly? What kind of services that would provide?
According to a statement, it's still pretty broad. It's still unclear to us what kinds of services that this clinic will provide or what they're aiming to provide. Texas Children's is one of the world's largest and leading pediatric hospitals based in the Houston's Medical Center. And in the hospital statement on the clinic, it did not say how it plans to roll it out or what services it will provide. All it said was that the clinic will provide multidisciplinary services that they already deliver to all their patients. But according to studies, detransitioning is when someone decides to stop or reverse transitioning care by many means. It could be social, medical, or legal. And so it can range from someone changing their pronouns back or dressing differently, or it could mean they stop taking puberty blockers. But in more extreme and rare cases, it could also mean hormone therapy and surgical intervention.
Well, Colleen, I know this is such an early stage of seeing how this ultimately gets implemented, but how might this affect how doctors practice in Texas moving forward? Are experts or perhaps advocates for the LGBTQ plus community weighing in on that now?
Yeah, we have not been able to reach out to any doctors. This broke this morning. But what we do know is that 5 doctors were terminated as part of this settlement. And I can imagine that this will limit access to all kinds of medical care for people in the transgender community, whether it's really related to their gender or not. Since the Attorney General is targeting the community so heavily, it may lead to the transgender community and possibly the overall queer community from avoiding medical care as a whole. And then on the doctor side, doctors may be hesitant to treat them over fear of losing their job. I mean, 5 lost their jobs today, and the community at the same time may be hesitant to reach out for the care in the first place. And when, research shows that when people avoid preventative care, that leads to a sicker community and rising medical costs across the board for everyone.
Yeah, certainly serious consequences with that. Well, Colleen DeGuzman, you've had certainly a busy week joining us yesterday as well as today to talk about your reporting. We appreciate it as always, and you all can check out her story on the Texas Tribune's website. But Colleen, thanks so much.
Thank you.